taken apart systematically. You're missing parts. I don't generally ask the names of bones. I ask you structures on the bones. So when you answer the structure, you have to name the bone in the structure. Right? There are some exceptions. For example, on the skull, if I ask you this, that's the occipital condyle. You don't have to say occipital condyle of the occipital, because that would be redundant. Yes. There are a few exceptions like that, right? Now you want to be very smart about taking this exam. There will be 13 stations with bones. I'm going to give you clues to what's in 7 of them. In fact, I'll tell you what's on 7 stations. There will be 1 station with a hand. And there'll be 1 station with a foot. Look, it's on a hand and a foot. Here's the foot. When you take these bones to your desk, please don't take a bunch of them. Take 1 or 2, and be sure and return them here in the right boxes. Otherwise, it's hard as hell for me to find out where stuff is without digging and wasting valuable time. It may not be valuable to you, it's very valuable to me. All right, we got a hand missing. Here's a foot in the wrong place. Some of these bones are plastic. Some of them are real. Bones that are real, please, please respect them. These are people, right? So don't be disrespectful. I'll call you out if you're disrespectful to bones. You think I'm joking? I'm not. You can't bring these things home. Even if you have a plan to steal them. It's a crime to have human bones at your house. Right? Why? Because, hey, if you throw them out on the side of the road, and somebody finds them, they're going to try to figure out who the hell these bones belong to. And they could spend $10,000 doing that. When they find out you're the one that threw them out there, you can owe somebody a whole bunch of money, not to mention some jail time. So, respect the bones. Right? There'll be 1 station with a hand. In that station, I'll simply ask you to name a couple of bones. That's the 1 exception. Well, that's 2. Be another station with a foot. Okay. There are ways to learn these bones when you have to learn a long series of them. It's called mnemonics. The N is silent. You can go online and Google anatomical mnemonics. They've got a whole bunch of them. For example, when you're learning the cranial nerves for the final, there's one called Old Olympus Terrastops of Finn and German Butzenhaus, which will give you the cranial nerves in sequence. Right? For the carpals, this is one of my favorites. They use it in house. Scared lovers try positions that they can't handle. And this lays out the carpals in sequence, beginning with the one from the thumb, the proximal one from the thumb going across, and then the next row, right? So it's the scaphoid, the lunate, the triangular, the pisiform, and then the trapezium, trapezoid, capitate, and hamate. These sing-song devices called mnemonics are very useful when learning lists of terms. All right, so there'll be a hand station and a foot station. Those are like giveaways, right? Super easy. There'll be a station with a pelvis. And 1 question will be sexy, right? Is this male or female? Male. You can tell because The pubic angle is so narrow. I always say guys are narrow-minded. Narrow angle. Gals have a wide pubic angle. You might call it obtuse, right? Versus acute. See, that's a gal, that's a guy. Of course, there's lots of other differences, but we'll get to that. There will be two stations with heads. I like real human heads, but if forced to, I'll use plastic. Two stations with heads. Same here, you have to learn all the holes, all the processes, and you have to name them as prescribed there. I use only heads that are closed, but I can ask you any part. I don't use heads that are open. For example, you will not see this on a station. You won't see inside. Right? If I use this skull, it'll be turned like this. It says that jawbone is. That's that there. All right? Keeping track of stations. We usually use a baby skull on one station. This is its jawbone, right? Baby skull. You used to like to ask the anterior fontanelle or one of the sutures. You have to know the joints. I like to ask the baby jaw, all right, because it's so easy to confuse with the hyoid bone. Pass them around to the other side. And the only rib I ask, there's a box full of ribs underneath here, like spaghetti. But the only rib I ever ask is rib 1. And that's usually found at a station. I'll ask you one of those two. Or some part there, and you'll have to know what the bone is. Vertebra. We've got these vertebral columns, but on the exam, we will ask individual vertebra. Oh, here's the hand I was looking for. Don't get lost. So, when you arrive at a station, there's going to be a vertebra or two, right? And I'll ask you to name processes or holes. For example, the hole is the vertebral foramen. Processes are the transverse processes. Dorsal spine, body, right? But you'll also have to identify the vertebra as to whether it's thoracic or cervical or lumbar. And you'll have to give me a number, except for the first one and the second one. You'll have to know the atlas and the axis by heart separately. 1 and 2. So you have to learn how to recognize the vertebra by number. And I'll be real generous. I'll let you miss it one way, one away, or one the other way, right? So if it's T2, I'll give you 1 and 3, right? So you can guess. It's pretty easy, and it's fun. Skull, we talked about, vertebra, pectoral vertebra, ribs, we talked about. Oh, yeah. Another possibility. You may walk up to a station where you see this femur, and rather than ask you to name this bone or anything on it, I'll ask you to name the bone that is anatomically inferior to this bone, which would be the tibia, right? Or I could put out the radius. But if I grab the radius fast and ask you to use the radius, to ask you the bone that is anatomically medial to it. Anatomical position, right? Which would be the ulna. So you have to know anatomical position. Only one question. will be anatomical position.